Let us now move on to the process of inflammation and how it actually works. Inflammation occurs when microbes invade our body tissues, causing them to have an inflammatory response. The symptoms of inflammation are pain, redness, swelling, and heat. So how does inflammation begin? Well, it starts off with the bacteria penetrating the skin after an injury. White blood cells will produce chemicals such as nitric oxide, cytokines, and histamine, which are chemical messengers to initiate inflammation. There are three key processes involved here: increased vascular permeability, vasodilation, and lastly, immigration of neutrophils. The increase in vascular permeability causes the gap in between the endothelial cells to expand, allowing plasma to leak out to the surrounding tissue. Vasodilation is a response that brings more blood to the damaged area. As you can see, the normal vessels look like this. When vasodilation occurs, it will look like this. The immigration of neutrophils is whereby neutrophils from your blood vessels leave the bloodstream and enter the site of infection. You might be wondering, how does white blood cells leave the bloodstream and enter the site of infection? This occurs through a process known as extravasation. What happens here is that the white blood cells will roll along the walls of the blood vessels by attaching and detaching from the selectins that are on the surface of the blood vessels. Once the white blood cells come to bind to a special receptor known as ICAM1, they will then stop rolling. They can now migrate to the damaged area by squeezing through in between neighboring blood vessel cells. Alright, that's all you need to know about inflammation. Thanks for watching!